Hello, I'm Jay Cahalan, President and CEO of Columbia Memorial. On the occasion of our annual meeting, we look back at the year and note the many milestones. It's also a time to take stock of where we are and pause long enough to recognize those who have helped us along the way. We will look ahead as well and tell you what we see on the horizon. But the first order of business is to thank you, our community, for all that you do to support Columbia Memorial. It's a team effort, and we very much appreciate that we are so well supported. That support comes from many angles and in many forms. It includes those with whom we partner to serve our community and community agencies of every description that have joined us in the collaborative toward improving the health of our population, helping us build integrated care that best serves the community. At a time when outcomes and accountability for a community's health have become paramount, this is exactly what the doctor ordered. Speaking of doctors, we have continued to refine our multi-specialty physician network, which provides services at numerous locations in Columbia and Greene counties, as well as in the town of Red Hook. This past year, we added a primary care office in Coxsackie, and the Columbia Memorial Physician Network now includes more than 30 distinct physician practices, delivering care within a full variety of specialties. We also welcome several new physicians who moved to the area to join us at Columbia Memorial, including physician specialists in areas such as obstetrics and gynecology, pediatrics, family practice, critical care, and inpatient medicine. In total, our network of physician and diagnostic testing services saw more than 420,000 individual outpatient visits during calendar year 2013, more than any other year in our history. And it's not just our own community that has taken notice. 3 of our physicians were recognized by Hudson Valley Magazine as top docs, and several Columbia Memorial physicians have been lauded for their contributions to community, research, lectures and presentations, as well as humanitarian missions and volunteerism. We are still adding to this complement of clinicians. At year's end, we opened an outpatient psychiatric service, which is entirely new to our network of care. This occurred when our long-standing and closely integrated partnership with the Marcus Psychiatric Group was transitioned to a Columbia Memorial owned and operated service. Offering outpatient behavioral health services allows extraordinary capabilities for the integration of primary care and behavioral health, and we are now operating these services at the Hudson campus and at Greene Medical Arts in Catskill, with the likelihood of an additional location coming online by year's end. Our community is geographically large, and to assure patient access, physician services are delivered at multiple locations in towns like Coxsackie, Cairo, Windham, Ghent, Chatham, and Copake, while the balance of physician services and diagnostic testing is delivered through our 3 main campus locations in Hudson, Catskill, and Valatia. The Valatia campus continues to expand service offerings with ever-increasing demand for the primary care services offered through Valatia Family Care and Kinderhook Medical. Blood draw services in Valatia are serving more patients than ever this year. We have recently added gastroenterology practice hours and have built out extra clinical space, giving us the option of providing additional physician specialty services over the upcoming year. Our rapid care facility in Valatia treated more than 11,000 patients in calendar year 2013, and we continue to see an increasing number of pediatric patients at this location. Last year, we developed a plan to centralize certain services to the Greene Medical Arts building in Catskill, and we are pleased to report that Jefferson Heights Family Care and Columbia Memorial Bone and Joint of Catskill have now relocated into newly renovated space within the Greene Medical Arts building. Prime Medical was also renovated without an interruption in services. In the short 18 months that we have owned the Greene Medical Arts building, we have completely renovated over 20,000 square feet of space and are in the process of completing significant renovation to the C-wing, inside and out. Now improved with a new facade and new windows, we are working within the building to complete a build-out of new space which will house our Catskill-based Columbia Memorial Pediatric Service, opening late summer. Renovations are also underway to accommodate an expanded outpatient behavioral health service within the Green Medical Arts Building, and we can report that these renovations are proceeding on schedule to achieve a fall opening. We also continue to add new technology at Green Medical Imaging. In addition to new radiography equipment, we recently installed a new open MRI scanner. The large open gantry offers the perfect solution for those who are apprehensive about close quarters. And this equipment is not just more comfortable, it is technologically advanced to the point that this scanner is appropriate for nearly all clinical indications requiring an MRI scan. Our new construction has not been limited to Green Medical Arts. Back at the hospital, we have completed the 6th floor renovation and have opened to rave reviews from patients and staff. The National Patient Satisfaction Survey results for the 6th floor have surpassed all expectations, and our staff has expressed their satisfaction with the functionality of the new space. Even without the unsurpassed views, the 6th floor is a very impressive space for healing. On the 5th floor, the expansion and renovation to our inpatient behavioral health unit nears completion. The addition of 4 new patient rooms, bringing the total to 22 beds, will serve a need in our community that many communities have been unable to serve at their hospital. Combined with our new outpatient behavioral health services, we expect to achieve the level of integration necessary to optimize patient care. At the Hudson River Bank and Trust Medical Office Building, our new Uro-Gyn service offers women treatment options for urinary system and bladder therapies that are unparalleled in Albany and the Hudson River Valley. Numerous treatments, rehabilitative techniques, and minimally invasive surgical procedures are available for women who want the very best care and access to the area's most advanced treatment options. In fact, Columbia Memorial was the first hospital in New York to receive accreditation from the American Institute of Minimally Invasive Surgery, and our clinicians were recognized for their accomplishment by a New York State Senate proclamation. Columbia Memorial's commitment to develop a center of excellence in Uro-Gyn services is clearly distinguishing our service from those of others. One of last year's new services, and another Columbia Memorial specialty service located in the medical office building, the Spine Institute, continues to grow and was recognized by a nomination for the Columbia County Chamber of Commerce Crystal Apple Award. This service continues to offer our patients comprehensive evaluation and treatment for conditions of the spine. Within the hospital, the observation unit has officially opened and is running around the clock, offering patients focused observation care and an alternative to spending time in the emergency department during long testing sequences. The 10-bed unit is staffed by physicians, physician assistants, and nurses specially trained for the acute care interventions and the diagnostics necessary for observation care. Patients are expressing tremendous satisfaction with this new service, and we believe it will continue to be a key service as we transform care delivery. At the heart of this transformation is the dedicated and caring staff of professionals that power Columbia Memorial. Now numbering more than 1,500 individuals, our staff live in our community among their patients, and as a result, often describe their role as one of taking care of friends and neighbors. This sense of community shows, and it is palpable in our provision of safe, high quality, and compassionate care. Everyone at Columbia Memorial considers their job, no matter the area where they work or what they do, to be an important part of the patient care equation. Again, this year our staff has demonstrated a sense of purpose and dedication to our patients that is often noticed in letters and comments by patients. Columbia Memorial staff have been recognized with national and regional awards, in addition to being recognized by their colleagues and peers. Many of the building improvements and equipment upgrades I have discussed are made possible by the unique spirit of volunteerism and giving that exists in our community. In calendar year 2013, individual and community contributions, foundation grants, the auxiliary, the second show, and Columbia Memorial fundraising events provided more than $1.5 million to the Columbia Green Hospital Foundation. These funds are used by Columbia Memorial to enhance technology and improve facilities. Individuals, community groups, and local foundations also gave to a number of causes, including the dental program, clinical education, free screenings, and new equipment. Our community is extremely generous with their time as well, and this year community volunteers provided more than 50,000 hours of direct volunteer service. I would be remiss to not also mention that Columbia Memorial is governed by a volunteer board, the Columbia Memorial Board of Trustees, while the Columbia Green Hospital Foundation Board governs charitable giving and fundraising. Members of both boards generously volunteer their expertise, advocacy, and support, and serve a key role as they govern during a time like no other for our nation's healthcare system. As we all know, the economics of healthcare is rapidly changing, and new reimbursement methodologies are bringing about a transformation for which Columbia Memorial is uniquely positioned. For calendar year 2013, even after the expansion and reinvestment that I have been describing, Columbia Memorial managed a bottom-line positive gain of $149,000. On a budget of $150 million, that's a very narrow margin, but an accomplishment in a year when we initiated and expanded multiple services, invested $8.5 million in property, plant, and equipment, and paid out over $92 million in salary and benefits to our 1,500 employees. At the same time, we're pleased to report that during calendar year 2013, we provided $8.5 million in free or unreimbursed care for those least able to afford it. The financial performance I have just outlined has taken place despite the pressing economic challenges of the day. As a healthcare organization, we are at a unique confluence of market forces, economic realities around the unsustainable cost of healthcare, and changes brought about through the new healthcare law. It is a time of unprecedented change in healthcare that has brought about transformative times. In the last 6 months, 2 hospitals within an hour's drive of our own service area filed for bankruptcy, and one of them abruptly closed. Many hospitals and healthcare organizations are struggling financially, and the healthcare industry is partnering, collaborating, and consolidating in response. Columbia Memorial is well situated, having invested in building a healthcare system that goes beyond the traditional hospital structure, a complete delivery system that can truly offer integrated care. Poised for the future, we are ready to avail ourselves of opportunities as they present, and we will no doubt expand our collaboration and partnership with community agencies. We will also develop new partnerships and collaborations with managed care agencies and other healthcare organizations. We are stepping into the era of population health and accountable care well prepared, and we are focused on strategic planning that not only builds our services for today, but ensures our ability to adapt to the care dynamic of tomorrow. In closing, we thank you, the community, for our many successes. Columbia Memorial is truly a community-based organization. And as always, if you need us, we'll be here for you 24/7.